No,
Did you
sir.
vote on the floor?
No, sir.
Okay, we're down to about, well, maybe 3 or 4 minutes left now, but I'll recognize you, but we're close to being out. But we got 4 or 5 votes, right?
4 votes.
4 votes.
Yes, sir.
Senator Scott, go ahead, but we're going to have to be very short.
Certainly, sir. I won't take more than 5 minutes, I promise. Well, the way the Senate time allows for 15 or 10 minutes to vote, but it always takes about 30 minutes to count 15 minutes in Washington. It's part of that fuzzy math that happens all the time and here in Washington, which really is one of the questions I'll be asking you about, Director Burwell. One of the questions will be the fuzzy math that seems to be a part of Obamacare. Other one will be about the promises made, promises not kept, and finally, whether you will be the ambassador of Obamacare or whether you will be the Secretary of Health and Human Services. I will say that I enjoyed our meeting together, and certainly you come before us with a great reputation. I voted for you for OMB. My good friends, men like Trey Gowdy, have great respect for your intellect and your integrity, and so I will take that into serious consideration. My questions will focus specifically on Obamacare and the dismal rollout that we've seen and the challenges that I have with the numbers, and hopefully you'll be able to bring some clarity and answer just a couple of questions as we rush to make sure that we make the last vote here. The numbers, fuzzy Washington math, the $1.4 trillion price tag between now and 2015, 2024, the fact that after spending nearly $1.5 trillion, we'll still have 31 million Americans uninsured by 2024, the fact that the ACA has siphoned about $716 billion from Medicare, and somehow that's supposed to improve the outcome of our seniors. Perhaps one of the more frustrating numbers that I've seen in Obamacare is the number 8 million people have signed up for Obamacare. One of my questions will be at the end, how pray tell do we account for 8 million people signing up for a program, but they don't pay the premium, yet we count that number as a part of a true number that reflects the number of Americans that are actually eligible for health insurance if they don't pay the premium. It seems to me that the number 8 million people signed up for Obamacare, when you multiply that by the 80% who've actually paid, it brings that number down significantly. And then when you drill into the numbers of those folks who have signed up for Obamacare and recognize that about 28% of those folks who've actually paid the premium represent those under the age of 35, and that brings into question the whole notion of the actuarially sound premise that we need about 2.8 million young folks buying into a program that they will hopefully not have to use in order to avoid adverse risk selection. Having spent a couple of years in the insurance industry myself, I find that those who sign up but don't pay premiums don't have coverage. And so that doesn't seem to be taken into consideration as we talk about the success of Obamacare. So I'd love to hear your perspective on that. And as I think about that, I'll simply ask the first question. If confirmed as our Health and Human Services Secretary, will you be willing to be clear and honest with the American people, the Congress, and this committee about the implementation of Obamacare, regardless of what the administration's policy is? You mentioned during our time that you have a lot of experience, served on MetLife board and others. It would be helpful for the American people to have a clear picture of what is in fact happening with Obamacare, since we now are relegated to getting our accurate information from the New York Times and the Washington Post and not from HHS.
Senator, you have my commitment that if I am confirmed, the 2 pieces of principles that will guide me with regard to information are transparency and accuracy. Those are the 2 things, and I will work to do that in due course in terms of speed as well.
Thank you, ma'am. On the issue of promises made, promises not kept, I think about the fact that many Americans were promised this notion that if you like your insurance, you can keep it. That promise has been broken. If you like your doctor, you can keep your doctor. That promise has been broken. If you're looking for affordable health care, the ACA is the way to go. That promise seems to be challenged when you think of the actual cost and the price of health insurance, the cost being higher deductibles, higher out-of-pocket expenses, a more limited number of doctors to choose from, fewer hospitals in the system, and even fewer specialists. So the actual cost of health care, I think we'll see it rise as we see the price tag not affordable to more than 50% of the folks who are eligible for Obamacare not signing up simply because they say they can't afford it. Then having a functioning website, well, we know how that's worked out. The most challenging part that I see from a backdoor perspective on the website is that the insurers themselves are complaining that the backdoor operations are simply not set up yet. So while we celebrate the success of the healthcare exchange and healthcare.gov, obviously if you can't get the inner workings pinned down on the back end, there's really hard to pay claims and do those things that are necessary for the insurers. I'd ask you simply, as Secretary of HHS, will you in fact be the Health and Human Services Secretary for the American people, or will you be, as your predecessor has been, the ambassador of Obamacare?
Senator, in my current role at OMB, and if I am confirmed in this other role, it is my objective, and as I've talked about in my opening statement, I'm here to serve the American people. I'm part of the President's administration. I'm honored to be appointed. First and foremost, I serve the American people. I believe that the President and his policies are aligned with that and will work, but I am here to serve the American people.
Thank you.
Thank you, Senator Scott. I would just say